Hello, right. I'm not a public speaker by any means, so I do apologise. I haven't done any slides because it'd just be loads of pictures of me looking dead tired and a bit stressed. So I've been asked to come and speak about kind of my experience. My partner's here, Sophie. She has TTP, obviously. Um, Now I won't go into loads of detail about her and her experience because she's speaking later. So I'll try and drop some spoiler alerts if I think I'm going to spoil what she's going to say. So our experience really was, yeah. I mean, in 1 week I became well, in a day, in 24 hours really, became a dad and an amateur haematologist, which was nice. Most people they get a nappy bag and a pram, and I got given a load of caplacizumab and a crash course on how to inject people with a massive fear of needles myself. I think I was more scared of dropping it into my own leg. So I suppose really I'm not going to talk about TTP because there's loads of dead smart people here who are going to talk about it, and there's loads of there's patients here who've gone through it. But really it's I'm not texting, by the way. I'm just looking at my notes. But yeah, really, I suppose what I'm here to talk about is what it's like when a really rare disease diagnosis kind of clashes with another really intense thing like childbirth and stuff like that. Really, so you go into the experience a childbirth, and it's going to be intense. It's going to be a bit complicated, painful. Not for me, but all the same. But what you don't expect is something like TTP to come and kind of hit you like a bus at the same time. When Sophie, when she was when she hit the third trimester, it all got a bit weird. A couple of TIAs. I say that dead casually, like just a couple of TIAs, but they were kind of dismissed as things like anemia and just general. I think a couple of times it was just put down to just being pregnant, which was But then during labour, it all got a bit spotty really quickly. Platelets were low. Where we live in Telford. Telford haven't got the best reputation anyway with maternity services, as some people probably know. So, seeing the staff all kind of panicking was, it was carnage really. Midwives didn't understand. Specialists were coming in, didn't really know what was going on either. There was platelets blue lighted in, which we now know is a big no-no. But at the time, platelets were low, would try and do what they can. So Arlo, our son, was delivered by emergency cesarean under general. So it's the experience wasn't what we were expecting. I wasn't allowed in the room, so I remember being stood there. They wheeled her out, and then it's just like, what do we do now? No one else in the room, just staring at the wall. Really, it was the longest 20 minutes of my life. And next thing, Arlo comes out, he's fine, and then you just kind of going, right, you just got a baby. Someone just gives you a baby, your baby, obviously. I mean, assume he was my baby. You've still got him. So, but and at the time, in throughout all the kind of the labour and stuff, we did have some really good consultants come in, who did kind of start to theorise. Oh, well, it could be something like TTP. It's probably not that because that's really rare. Obviously, that was wrong. Following the birth, we were in Telford Hospital for a couple of days while Sophie's blood did a tour of the UK, going to various medical centres and to be tested, blood films and stuff like that. Eventually, it came back that it was TTP or suspected TTP. So Sophie was blue lighted up to Birmingham, and at that point, again stood there, child. Oh my God, what do I do? Changing nappies and doing bottles and things like that. So after Sophie got to Birmingham, it was about 24 hours before I could get there. But part of the experience as a family member is kind of we're fortunate enough that Sophie was able to communicate still at this point. You know, she was still fairly compos mentis, although, you know, there was still episodes of brain fog and things like that going on. So I suppose it kind of goes into what the role of a friend, a family member, a partner is kind of, you know, Sophie was taken up in at the weekend. It was out of hours, you know, while there was a Dr. Percy, who's one of the specialist consultants over at Birmingham, was there initially. That treatment kind of came just via the general oncology department and so the hematology department. So it was a bit, you know, that kind of experience that a lot of people have about having things explained to them in a certain way. I was kind of doing that over the phone, which is difficult, you know, because when you're being told that you might have this TTP, and you know, for Sophie and for, I'm sure, you know, a lot of patients who go through it, when you ask a consultant or a nurse or a doctor who does get what it is, you know, am I going to be okay? They don't know. You might be, you might not be. Trying to manage that with a newborn and trying to kind of allay her concerns and anxiety, it was busy. So, you know, within 24 hours I managed to get up there. Sophie was going through plasmapheresis at the time. So that was, you know, again, it was just one of them moments where you walk in and see effectively a garden hose coming out of a groin, and a big bag of horrible, cloudy stuff that looks like apple juice, plasma. And then you kind of go through this thing where I think the chaos of it all, you just kind of crack on because you've got to, because you've got a newborn baby that kind of needs you. You've got a partner that needs you, and you know, trying to translate all these big words and confusing sentences and, you know, unsure things. It's kind of, you've just got to do it. So at this point, we're kind of starting to understand a little bit more about what TTP is. I obviously Googled it. Again, like everyone says, never Google it. But, you know, at the same time, I think it's important to understand the reality of what it could be in that moment, because it kind of, you need to be able to crack on, and you need to do what you need to do, and you need to be able to support who you're supporting. So when she pulled through the worst of it, we, you know, it's a complicated illness, and you kind of expect things to settle, but obviously, as we know, TTP is a very long and windy road, and so is parenthood. So, you know, we went on one journey, we were on two. You know, Sophie was discharged, and again, like I say, I remember specifically and vividly just before we left, you know, the first dose of Kaplan, and even the nurses, you know, she's got the paper out and she's like, how do we do this? This is complicated, isn't it? And I'm like, yeah, it's a nice one. Knowing full well it was going to be me putting it together when I got home. You know, getting home, juggling hospital appointments with night feeds, steroid side effects with nappy changes. You know, I've got a partner there that's trying to heal from both a birth and a near-death experience. So yeah, that was nice. So, you know, caprotizumab, tiny vial, packs a punch, life-saving medicine, but it added such a layer. I had to learn how to inject it in the stomach, and as I'm sure many of you know, you expect the medication to just come out of the box ready to use. No, this is like a Lego set. And I remember vividly just looking at it all out on the kitchen side, and yeah, I felt like I was in Breaking Bad. It was bizarre. Anyway, it became quite routine to the point where I timed myself. I got dead good at it, and then we stopped, which is good. It's good that we stopped, but I reckon I could have got a little bit quicker and a little bit better. I think I caused almost as much damage with the initial injections, to be honest. It was like watching, it was, yeah, not good at all. But by the end, you know. So, you know, part of kind of what I want to talk about from the patient partner, family member, friend kind of side of it is not just what goes on with in that initial diagnosis and everything that comes after. It's not everything about the initial diagnosis. It's also about what comes after, and you know you've really got a lot of things to deal with. You know, it's the emotional reality is you don't think about it when you're in it because you just have to cope. You know, there's a lot to consider. You know, there's guilt because you want to do everything perfectly and you can't because you're trying to, you know, you're supporting someone who's going through something massive. You're trying to do the right thing with a baby that will not sleep. Turns out they had a milk allergy. You know, there's also that initially that fear that the other shoe is going to drop, and you know there's that fear of, is she going to get better? Because obviously you're still looking at, are the blood's going to get, you know, are the platelets going to get better? Are the adam's going to get better? You know, and you kind of always have that thing of, is the support you're giving enough? Is it the right thing? Are you doing the right thing? Where do you prioritise your energy and your time, because you can't give 100% to everything, so you kind of have to be really structured with it. Again, we were quite fortunate that you know, Sophie responded really well to treatment. So childcare wise, you know, she was stuck in as soon as she could be. You know, the reality of sport and so on with TTP is it's not just emotional; it's actually deeply practical. You know, it's planning days around appointments. It's getting up because, you know, steroid side effects have given them insomnia. It's just being available to talk to at any point, at any time, and being able to find that balance between just listening and trying to rationalize things as well, because, you know, it's a massive trauma. And what our kind of role is, as I see it, is to be that kind of bit of everything, to be able to go, you know, do we need to call the hospital? Should we go to A&E in the morning? Do we not need to go to A&E in the morning? And, you know, as time goes on, that pull and that temptation to go, be fine, just a bruise, it gets dead big. Because why would you choose to go to hospital to talk to another doctor who does the old, you know, knock knock, who's there, TTP, ITP, who? Because that is the game you play. You know, within that first kind of 6 months, and you know, forever long term, really, it's managing the anxiety, not just your own but theirs. But at the same time, you have to learn how to understand blood test results. You have to be able to take what your consultant might have said, and you have to store that in your head, and then you might have to kind of retranslate that, because everyone communicates differently. And another thing that's important is sorry, I've done that. It's being able to translate that into a format that person needs at that time, because sometimes people want the detail, they want the everything. Sometimes people just want the bite-sized information of, yeah, you're okay, see you in 3 months. But sometimes, you know, there is stuff to talk about. We have to understand what the blood tests are. You know, Sophie tracks her everything meticulously. If you put it into a spreadsheet, it'd be the biggest pivot chart you've ever seen. You know, but at the same time, and specifically for me, for that first couple of months, it's about hiding how scared you are as well, because you are, because you don't know what's going to come, because you've got Google, you've got consultants, you've got nurses and doctors, and some are dead good at communicating, some aren't dead good at communicating. Everyone within the specialist TTP staff, fantastic, but you don't always get that. You have to deal with people in A&E, you have to deal with GPs who also just don't get it. Yeah, but you know, support it's the truth of it is messy, it's tightless, but you know, it's about small repetitive acts that keep people, you know, safe, alive, and well. Because ultimately, you know, the symptoms that come with something like TTP, like brain fog and confusion and things like that, you know, the person you're supporting might not have the capacity to understand what's going on at that time, so you need to be vigilant always. So, you know, TTP, it's like a storm. It's uninvited, it's brutal, and it's quite unforgettable. But we're still here. You know, Arlo's now 2. We still have the odd bruise, but by and large they have faded. You know, the fear and anxiety, while it's always there in some way, it doesn't run the show anymore, whereas it kind of does for a bit. Maybe some people have different experiences, but certainly that's mine. And you kind of, something like TTP really highlights how resilient people can be. You know, not just the people suffering with the episode, but the people around them. I think it really highlights everything that's going on. You know, ultimately, you're there having to communicate what this is to a multitude of different people, like family, friends, work, and things like that. Work, sent them away to Google. They never question whether I need to go to an appointment now with Sophie if I need to go, because they just go, oh God, yeah, that's dead bad. I go, yeah, but you know, family and friends, you have to take you know, a much more subtle approach, because you don't want to panic everyone, because you can quite easily. I think if I know there's a lot of family, friends, and partners and things here of people with TTP, and you know, just I suppose to say what you do matters. It does. You know, it can be tiring, it can be scary, it can be overwhelmed, but we're just human, aren't we? So it's the stuff we've got to go through to support the people that we care about. You know, and I think I've got right to the end of my slides, and I've absolutely blitzed through that. I'm not going to ask if anyone's got any questions, because I'd give you a dead rubbish answer. So can I please go back to my seat, Joe? Thank you very much.